Treatment for sciatica can be highly confusing for people, and it's very frustrating to suffer with sciatica problems longer than anybody should. I'm going to cover with you today the top 7 do's and don'ts of sciatica treatment at home. Number 1, do exercise. It's extremely important for people suffering from sciatica problems to get in some sort of exercise. Now, finding out what works best is a bit of trial and error, and it's often not what people think. I often hear people say, I'm going to go walk to help out the sciatica problem because walking is thought of as a great exercise for a lot of things. Most of the time, it can be helpful, but walking for a sciatica problem often ends up making it worse in the long run. There's usually some sort of strengthening exercise that needs to be done, typically on the butt muscles and the glutes, sometimes on the abs as well, and other muscles in order to get this sciatica problem under control. A great one to start out with is simply by squeezing the butt muscles. For somebody suffering from a sciatica problem, get on 2 feet and then tighten up the glutes, hold it for about 10 to 15 seconds, then release it all the way for a few seconds and repeat that for about a minute or 2. Once that happens, typically there's more support to those muscles, the pelvis is better aligned and supported, and it can put some relief on a tight sciatica nerve issue. Number 2, don't get a massage. Many of our clients are looking for help, they're looking for some sort of short-term relief, and a massage is a great, easy option for them that they can just lie down on a table, get rubbed on. And sometimes the massage can kind of hurt whenever they dig in there real hard, and that's because it is hurting the sciatic nerve. Nerves don't like excessive pressure. Now, when a sciatic nerve is irritated, it can cause muscles to spasm and harden, and massaging that can be beneficial. But most massage therapists have a hard time differentiating if they're on a muscle or a nerve. It's pretty hard to find that right balance. If you got a massage therapist that can do that, then you're very lucky, but 9 times out of 10, it's hard to tell the difference. So I would err on the side of avoiding a massage for fear of making that sciatic nerve problem worse. Number 3, do use ice and heat. Ice and heat can be very effective at lowering the pain levels of sciatica to make it tolerable to go to sleep at night, to sit for longer periods of time, especially for people that are stuck on a car ride. It can get things under control. Now, it does take a bit of equipment. Obviously, you have to have a hot pack or an ice pack, but it's a great alternative. It's natural. It doesn't involve anybody taking medications, injections, and hopefully can stave off any sort of invasive procedures. Number 4, don't stretch. Stretching is overdone. So many people come in telling us that they've been stretching to help their sciatica problem, and it just doesn't help out. It can change the sensation of the sciatica issue. It can put a different feel on it because you're stretching out muscles, but it can also aggravate nerves. The 2 things that nerves hate the most, like with massage, pressure, but the second is excessive stretching. Nerves have the ability to stretch and shorten, and when they're aggravated, they tend to shorten a bit. And so stretching out a shortened, aggravated nerve, it just doesn't make sense. And it's not something to be doing long term. It's confusing and a little odd whenever we tell patients here in the clinic, stop doing that figure 4 stretch, stop crossing your leg over and pushing your knee down to get that butt stretch. And once they stop doing it and start doing some strengthening exercises or the other treatments that we might have them to do here, they get better. It really does improve for the long term. So stretching is overdone. It's a don't for sure. Number 5, do drink lots of water, especially in Texas where we're at here or any sort of hot states or summer months. It's important to stay hydrated and get enough water. Some sciatic problems are related to disc injuries in the lower back, and discs are responsive to how hydrated you are. So you can actually mess with your disc height if you drink plenty of water. It also helps with other tissues in the body and helps with healing in general. So getting adequate water is a great easy step to take to begin to get some relief for a pinched sciatic nerve problem. Tip number 6, don't wait more than about 7 to 14 days to get some help if this problem persists. Now, the problem may stay the same. I would call that bad. You want it to be getting better because some people do have a flare-up of sciatica, and then within a few days it gets better and eventually goes away. that's great if that's happened. Now, you definitely don't want it to get worse. If it's just getting progressively worse, and most people go get help right away, but if it's staying the same, that's when I think it's most dangerous. It's important to not let that happen. The other one is if the pain comes on, the sciatica issue comes on, then goes away pretty quickly. It only lasts for a day or two or three, then it's gone, and then maybe a month or two or a few months later returns stronger and maybe lasts just a bit longer. You bet it's just a matter of time before the third time happens and that gets worse, and the fourth time happens and that gets worse, and it snowballs and eventually becomes a problem that lasts 7 to 14 days. That's the story we frequently hear. I've had that happen myself, and it's important to disrupt that cycle when it's not that bad. It's much more manageable if we catch a sciatica problem early. It doesn't take as much treatment and it goes way faster, and you never miss out on all the quality of life stuff that people miss out on when they're suffering from a sciatica issue. Sleep, their mood, their ability to sit as long as they want, being able to watch a movie, being able to exercise and walk for leisure and fun. It's just, that's not something that we want for anybody. Tip number 7, get expert help. If your problem is lasting way too long, don't hesitate to call up somebody like a specialist physical therapist who's an expert at helping this problem, especially non-surgically without medications or injections. Ask for help, find out what needs to be done. It's surprising for most people. Sometimes it's just a short amount of treatments, despite it being extremely painful, to correct a problem with sciatica, a pelvic-related problem or a strength problem. Sometimes it can be more, especially if there's a herniated disc involved or multiple problems throughout the pathway of the sciatic nerve. But getting expert help is a sure way to get the problem to reduce on a consistent basis. It makes sure to get the problem as close to 100% better rather than settling at 50, 60, or 70%. Here at El Paso Manual Physical Therapy, we are pushing every client to reach their full potential for improvement for any sciatica problem they come in for. Hey, if this video was helpful for you, hit the subscribe button below here and go over to our YouTube channel and find the playlist that has all our videos about sciatica problems. And there you can find more tips and advice. And please share this video with somebody that you think needs to hear this so that they can begin to get some improvement on their sciatica problem. We'll talk soon. Bye-bye.